Hey, Margie here. Did you know that genetic testing can help us figure out the root causes of bone loss and give us guidance on our optimal health plan? Well, today, that's what we're going to be talking about with our special guest, Dr. Victoria McDonald. And Dr. McDonald is a concierge pharmacist with guided holistic health. She focuses on education and empowering people in their own health. In her practice, she determines if medications are really necessary and is there a way to get off them. And when appropriate, she switches people to high quality natural options and creates a health plan that's personalized to their unique body and situation. And Dr. Victoria uses various lab tests that aren't commonly done in a doctor's office. And those include genetics, nutrition, hormones, toxicity, and more. But today, we're going to focus on genetic testing and how that can give us clues to root causes of bone loss, and then how we can use this information when we create our own unique optimal health plan. So stay tuned for all this great information. Welcome, Dr. Victoria. I'm really happy to have you here with me because it was so interesting when we met. When we met, I was interviewed for your summit. And when I heard exactly what you did, I said, you know what, you have to come and talk and come on the podcast because I think you have really important information that can give us another piece of the equation that we might be missing. So so first of all, welcome.
Thank you, Margie. I appreciate you having me today.
And let's start. You do something called nutrigenomics. So let's start off by giving a definition of, first of all, what that is, because it sounds like nutrigenomics. It's a fancy word. And what does it really mean? So let's just start off with what exactly you've been doing.
Right, of course. So, nutrigenomics is kind of like a fancy word for personalized nutrition. We're looking at an individual's DNA and looking at how it interacts and is influenced by the environment, by the foods that we're eating, by the toxins that we're coming in contact with, um, by just how our genetics that we were born with, and then even what our parents and our grandparents did with the different things in their environment, because there is this historical influence on our genetics that can span decades. It can span, I believe it's 7 generations. And so what we're doing with our bodies now is then going to influence our children and our grandchildren and our grandchildren's children. And so really paying attention to what goes into our body is going to flip different switches with our genes. And that is what I specialize in.
Oh, I love this. So since we have an audience who's very interested in bone, let's take it to the bones. So when people come to see you, then you'll do certain testing. And what information will that give us? First of all, I think for a lot of people, it's shocking. We think, okay, next child's born, it's a clean slate. Now, you have genes, but you don't know that what you did could actually have an effect. So that may make people even take more care of themselves. But let's talk about, so a person comes in, what specifically, what testing would you do and what information would they get that could influence their bone health?
Of course. So that is such a great question because our bodies come with a blueprint. They essentially, like we always joke that, our kids didn't come with an instruction manual, but our bodies came with this blueprint of what they need and what they can use, what they know how to use, and how we can influence it to maybe turn this off or turn this on. And so really understanding what those different genes mean is important and provides so much information that we can use going forward and do a tailored therapy for the individual. Now, thinking about vitamin D specifically, that can act as a switch for so many other genes. And those genes can be responsible for immunity, heart health, bone health, hormones, and your glucose levels. And so everything is intertwined with the body. So it's not as easy or cut and dry with the genetics to say that vitamin D is just controlled by this gene and turning that gene on and off is then going to result in good, healthy bones or weaker bones. So it is a little bit of a web that does require some untangling to really know, okay, which pathway is the dominant way that the vitamin D is going through the metabolism, or how much of it is going to immunity, how much is going to heart health, how much is going to bone. So paying attention to those differences is super important. Now, there's also more genes than just the ones that affect vitamin D that really play a factor here. And so there are collagen genes, uh, and those are the col1a1 gene. And then there's ones that help bone development and repair. So then there's the bone development gene as well that really helps with the osteoblasts and the osteoclasts, helping to manage them and make sure that we're not having too many osteoclasts that are destroying the bones, that are breaking them down before we can build them up. So making sure there's a balance there. There's also the thyroid hormone gene, and that is helping to manage the metabolism as well. And so then there's also the bone remodeling gene, and then there's also estrogen as well. And man or woman, doesn't matter. We all have estrogen, and estrogen plays a part in our bone health specifically. So knowing that is huge. That's not just a single piece of the pie that we're just evaluating here. So looking at vitamin D is involved in how our bodies can use these different minerals in our body. And part of that starts with the absorption in the gut. So there are different genes that are specific to the gut that are pulling that vitamin D has to activate. It has to turn on for us to get these calcium and phosphorus into our body, into the bloodstream. And so first off, we have to make sure our vitamin D levels are optimum for that. If our vitamin D levels are too high, it can actually have the opposite effect and turn it on. So making sure that we have a vitamin D level that's optimum and that is converting from D2 to D3, that conversion has to happen. So those different processes in the body, especially in the liver and in the kidneys, to activate it and make sure that it gets to the part of the body that it needs to get to in order to bring in that calcium and bring in that phosphorus.
Can I ask you
Now,
something before we go? Or
of course,
before we go beyond? Or do you want? Is there anything more about vitamin D? Because I have some questions that you want to say.
go ahead and
Okay,
ask
yeah,
the
my
question.
questions are, okay, so if someone gets their vitamin D, and most people get the 25 hydroxy, and sometimes they're also checking the active form as well in the blood work. But if they're getting that test and their vitamin D level is okay, is it still necessary to check the genes? Or is this more for someone, because I see this a lot where people will have chronically low levels and they're taking vitamin D. And they're like, "I don't know why my level is so low." Is that more the person that's gonna have an issue with their genes?
So the so this is going to be more for a guide as to what's going wrong, not going wrong, but what might be the culprit. So the person who has amazing bone density or has a great vitamin D level, this may not be as informative, but because vitamin D interfaces with so many other things, it can mean that maybe their estrogen's off, and then their estrogen's off because of a vitamin D and different pathway. And so just looking at it straight as blood level may just be indicative of how the bone health is doing and not how the cardiovascular or the immune health is. And so that's something to still investigate. It's still valuable information, but they may not have any differences, variations in their DNA, and it may just be normal. Or there could be other culprits, toxins, um, other things that are leaching the vitamin D or blocking the vitamin D from from doing that conversion in the first place. But to answer your question, yes. So when we're taking supplement after supplement of vitamin D and we're making sure that it's coming from a really pure source, it's a high quality grade, and we're going out in the sunlight, we're making sure we're getting natural sunlight, and then our vitamin D levels are still like in the toilet and we're not sure why. Then checking our DNA, checking for those different enzymes and proteins. And do we have any differences, any variations from a vast population? Is that possibly the culprit? But then also it could still be there are these other factors as well, such as the environment, such as toxins, such as other blockers that may be stealing it before it can even possibly get to the right place it needs to. So It is not the be all end all answer, but it is a huge clue as to what's going on. It's a huge piece to the pie. And so
And so
it
at
is,
this point, do you wanna say what a person would do? So, here they
yeah.
have a low vitamin D level, and they see you, and then you find out that there are genetic variants and there are some issues going on where, they're with vitamin D. So why would this information be important, and how do you, in your practice, utilize this then?
So my practice, we I ordered the lab test. It gets shipped to your home. And then you do a quick cheek swab, put it back in the kit, and mail it off to the lab. In about 3 to 4 weeks, the lab has finished its analysis and I get the results. Now, since I'm specially trained in it, I can untangle the web that really is this 40 page report of all the different genes variants in it. And then looking at how one gene influences another gene. And then I also take a detailed history of what is going on currently, what's in your environment, whether the lab values you may have, whether that be calcium levels, vitamin D levels, bone density, etc. But then putting that all together and then really going, okay, this is not working how it's supposed to, or not how we intended it to. And what can we do about it? And what are the other alternatives? Maybe we need to influence a different gene in order to get our vitamin D activation pathway working. And so I get to get down to the root cause, really the nitty gritty, but on that cellular level. And so that is one of the benefits that I can bring to everyone here who's listening or watching. We're looking at unraveling kind of the mystery, what's going on behind closed doors, if you will, as far as what's going on with your body, and really providing a pathway or answers of how to work with your body instead of against your body, and just like cramming things down and hoping that it works. So I provide that information and that pathway.
Can you give us, like, a specific example? Like someone, because this example is common where the person, again, just like I said before, their vitamin D level is really low, but they are taking vitamin D and they are out in the sun. And so, like, give me an example of, like, one thing you would see and how you would change that, given this report comes in, like, specific so people can sort of see,
Okay.
"Oh, yeah,
All
okay."
right. So specifically, the CYP2R1 gene is one of the ones that are very dominant in the vitamin D pathway. Now, it is not the only pathway, but looking at that and seeing that there's a variant in it means that the vitamin D is not even getting to the liver to become its active form or its storage form before it can even go to active form. And so it's just going around in essentially that you just bought the OTC version of vitamin 3 and it's still staying in that form in the body and it's not even able to be used. So we're also going to see low calcium levels in your blood. We're also going to see low phosphate levels in your blood. So that's going to more point me to that it is that CYP2R1 gene. Now, the way we can help work against it is getting a different form of the vitamin D would be more beneficial in that instance. So that way it can kind of skip that step. So instead of just getting the OTC vitamin D, then you would get the prescription vitamin D. And that would also justify that cost, showing that there's a reason why you need that prescription vitamin D versus the OTC vitamin D. Or even there are other levels of prescription vitamin D, the calcitriol specifically, versus just vitamin D2. And so this would also justify or show why you would need that prescription level involvement instead of just doing the over the counter or going outside and getting more and more sun. Does
Oh,
that
that's so
answer your
interesting.
question?
Yes, yes. But what is, because most people do just get the over the counter and hopefully they get a really good quality that's not full of fillers and other things. But what's the big difference with the prescription versus having just a very high amount of over the counter?
So the prescription one is vitamin D at an early stage in the pathway. The vitamin D2, kind of that green capsule that it most often comes as, is a middle step of the pathway, and the calcitriol is further along in the pathway. And so depending on where you're adding it into the pathway is going to be where it can continue. If you're adding something on at the beginning, but there's a stop point because it can't get through that, because it can't get doesn't have the enzyme to get from point A to point B, then you're just going to keep pouring more against it, and you're not ever going to get the active vitamin D that you need. But if the stop point is a little bit further down the pathway, then you can put more D3 in, more D3, and then it's going to get there, but slower. It's going to take a little bit slower time to get there. And then you also have to be careful of being consistent. If you're taking more D3, like at the beginning of the month, but not at the end of the month, then you're pouring more D3 in there and you're going to get the benefits eventually, but then they're going to peter off by the next month when you start them all over again. And so the consistency, making sure that you're taking it at least weekly, some cases daily, depending on your situation. So that way it is constantly getting into your body. And even if it takes a slow amount, if you're consistent, that's just going to be that little trickle all the time instead of trickle nothing. And like I said, the vitamin D is so necessary for so many other systems as well, not just bones, that if we're just getting this trickle in and then our bones are going to use it up, or it's going to be competition. Our immunity is going to say, yeah, that vitamin D is mine. You don't get any bones. And so then there's that competition, the fighting over it. And then there's not enough to go around. And then the bones are going to start depleting because they don't have the vitamin D to help bring in that calcium and the phosphate.
Wow, this is so interesting. So for me, I'm a big root cause person, and I always like to get to the bottom of it. And it's never as simple, just like you said, there's never a simple solution, but you can be a detective. And once you figure it out, it's amazing how things start to work. That's why I'm so happy you're here, because that's really important, because so many people are just confused. I don't know why my vitamin D, and they're spending a lot of money. You're taking these supplements. Not that that's one of the more expensive ones, but still, you're taking things and you just don't understand why they're not working. So what you're saying is, if I just want to make sure that there are different things, when you look at this, you can really see the pathway, you can see what's happening. And if it's not, you can give a recommendation. Well, you know what? Don't take this one, take this one. This will work with your
Mhm.
system. Wow. So that's really so very helpful. Okay, so
Yeah,
let's
we understand the body on such that cellular level, that deep level, and where things go once they enter the body. So yeah, we can answer that question. Okay,
that
yours deviates over here, and we need it to go over here. Do this, so that way it goes over here instead.
Oh, I just love this. Okay, so let's continue, but you also have another word. So maybe even before, if you want to define this before you continue on all the other things, nutrigenetics. And what's the difference with that? Nutrigenomics versus nutrigenetics.
So nutrigenetics is specifically, it's kind of like the opposite. So the other one is how our nutrigenomics is how our body is influenced by the things around us. But nutrigenetics is more how these variations in our DNA influence how we interact with the environment. So it's more how our bodies interact with the food that we eat and how it interacts with the different toxins that come in. So the toxins or the foods that we eat can turn something on, then the genes in our body can also turn something off. And so those are two different categorization for it, but they both work together essentially. So one is turning things on and off, and then the other one is turning things on and off. And so it is a cyclical thing, and it really involves a lot of information knowing, is it the environment turning things on and off, or is it our body turning things on and off, or is it a combination?
Oh, so important. So, because it really helps us on the pathway, because we want to do everything we can. And sometimes it's so overwhelming. There's so many things to do. So by looking at both of these, we can sort of key in on what are the most important things that we need to do that's going to be most effective for our particular body, instead of sort of guessing. Yeah. So let's continue. Okay. So is there anything more about the vitamin D that was so very interesting, and it could answer a lot of people's issues and really put them on the right track?
So yes, there is another major gene that goes along with vitamin D. So vitamin D, CYP2R1, helps with the metabolism, helps that to get from just the tablet over the sun to get to its active form and into our body. Now, there is another gene that's responsible for the receptor and how it can activate and use that vitamin D, and that's called the VDR. And so we can have all this active and perfect vitamin D in our body, yeah, this active form of vitamin D. But if our body receptors can't use it, then it's just floating around, waiting to go to a party, but it doesn't have the invitation anymore. And so we need the VDR to be in its best shape. Uh, there are different stages of metabolism and how it would work. So the most common categorizations are poor metabolizers, intermediate metabolizers, and high metabolizers. And so if your gene, your VDR is a low or a poor metabolizer, then you're not going to be able to use that vitamin D, even if your blood levels are amazing, but you're not going to be able to use it in the bone. You're not going to be able to activate the different receptors in the body to turn on. Okay, now it's time to turn on our immunity. Now it's time to pull in more calcium and phosphate. Now it's time to send the vitamin D to our heart. So it's not going to have that shuttle to go to these different places in the body because this part of the gene is, or this part of your DNA is not, doesn't have as much expression or doesn't show up as much. And so that's just something else I wanted to point out with the VDR is a second huge component with vitamin D.
Well, wait, before we go any further, this is
Yeah.
huge. This is so huge what you said, because your blood level, so you get your blood work back and your vitamin D is, 50 or whatever it is, your vitamin D looks really good. Your 25 hydroxy vitamin D level. So what you're saying is, even though that looks good, if the receptors, if the VDR, the vitamin D receptors is there an issue with them, then your body's not going to utilize this. So that could be an underlying root cause and really be affecting your bone health. And the only way you could check the VDR is through this type of testing.
Is through this type of testing. And then you'd be able to know what its function is. And then you can anticipate it. But you do have to know. And sometimes the VDR can also help to provide information. Are you at a higher risk of breast cancer because your VDR is a low or a poor metabolizer? So it can also be connected to how your body accepts transplants, especially kidney transplants, and what it can do with those. And so, and also inflammation and diabetes. So this VDR receptor is hugely innervated and complex, but it helps to impact all these other components of our bodies. And so knowing if the vitamin D, if it can even use the vitamin D, and if it can send that vitamin D to other parts of the body, will help us to know, are we going to have potentially higher risk for these other conditions?
Wow, this is just so interesting because I don't think first of all, how common is this to have an issue with the VDR? You know,
The VDR is not as common. So it is about 5% in the European population. And it's even lower in other populations, but it's definitely there. And so it just may be the missing piece to what's going on with you individually. Some of these other genes, they are more common to have some variants in them, but it is, I don't know, it's still an emerging science, and we're learning more and more every day about what pathways they're going, what genes are impacting that pathway, and then what percent of the population is this actually affecting. And so it's like these studies, they're literally coming out every day as far as what information we're learning from it.
but if that's you, you need this piece. So what
Yes,
happens? The
exactly.
person that finds out there's an issue with their DVR, what can they do?
So part of it is just we're on more high alert. We're paying attention. We're testing for cancer more often. We're checking your immunity. We're making sure your gut health is active. So that way we can get calcium and phosphate through other means potentially, or making sure that they're a higher quality means. So that way they don't need that vitamin D to bring them across the barrier to get to the bones. We're checking your glucose levels and inflammation levels more often, or the inflammation markers, just so that we can kind of work on the other side of this receptor. We can also potentially impact it by removing different toxins in our life. And that may turn that switch back on so that the receptor can start pulling the vitamin D and start shuttling it to the different parts of the body that it needs to go. But it does require a lot more vigilance. It does require also paying attention to the downstream of it and seeing where things are being affected, because we've got this block, or at least this trickle maybe, upstream.
That's so interesting. So that would be the person where you would go on and really, really evaluate
A little
toxins and
bit
really
deep.
get more testing and and see what else can be done. That's so interesting. All right, so let's go on. So I think we've hit the vitamin D. What are the
Mhm.
other key things you see that could be affecting bone health that people that might be one of their issues that they don't know about?
So collagen, a lot of people don't like we think of collagen, but it's more like skin, nails, beauty. But collagen is such a huge component of our bones and our underlying bone structure. A lot of that is built up as infants when we're just first developing. That's why our bones are kind of rubbery as kids. Um, but still, that collagen is necessary as an adult, and it helps to balance the breakdown of bone and the buildup of bone, and making sure that we have it kind of them both going at the same rate. Because we know if the breakdown starts going more, those osteoclasts are breaking it down. Then then we start getting more osteoporosis or at least osteopenia coming out. And the big gene that is associated with collagen is the COL1A1. And that one specifically works on type 1 collagen and makes it so that the alpha 1 chain and the alpha 2 chain are not equal. And when they're not equal, that's when we get that imbalance of a breakdown and making of the bone. And so that is something just to be aware of, and that would lead you to be more likely to develop osteopenia or osteoporosis, regardless of how much calcium and vitamin D you're having. And so it's just working against your system at that point.
Okay, let's break this down a little bit because I'm a big believer in collagen, and I recommend collagen for the majority of people. Some people have anxiety issues with collagen, but for the most part, um, I think collagen's a wonderful thing. So if you had this gene, just taking collagen wouldn't wouldn't be the problem here? That's not gonna help?
So if you take a supplemental collagen, that actually would help because the COL1A1 is more the breaking it down and breaking because collagen is usually really, really long chains of a chemical compound. And so it cups it up and breaks it down. So that's what this gene is doing. So if you're taking a supplement of those smaller chains already versus taking a less quality collagen supplement is usually going to be those really long chains. If it's that long chain, you're essentially not doing your body any help because you're just putting the same thing in that it can't do anything with, or at least can't do very efficiently. So you would want to make sure it's a higher quality collagen that does break it up into those smaller chains, especially the type 1 collagen.
So what would you look for? I mean, what exactly would you be looking for in terms of
So you would want to look on the back on the ingredient panel or the nutrition panel to see if it lists the type of collagens that are in it, if it has type 1 broken down, if it has type 1, 1, 2, 6, and 7 are going to be the primary ones. But this particular gene is only works on type 1. And type 1 is typically what our body uses the most anyway. So making sure that it does have that listed on the nutrition panel. If it doesn't, then it's very likely just a really, really long chain of collagen. And so your body's not going to be able to cut it up as easily.
if you don't have this gene, or if
Right.
you if you
If you
have this
do have
problem.
this gene.
Yeah, the
Mhm.
SNP, the problem. And very interesting. Is that common as well?
So no, this one's not quite as common. This one's more like in the 1% or the 0.5 to 1%, but it is still something to be aware of, especially if you know you have a family history with bone issues, with lots of fractures. There's issues with soft tissue damage with athletes or people who are really active, then the collagen does also affect those soft tissue injuries as well. So if you don't have a lot of collagen, it makes it harder to heal those, and then you end up with just more scarring or more, uh, I guess, less strength,
Yeah,
underlying
and
strength.
there are people like that. I know we all know
Mm.
people who, every bone has been fractured or they have a minor fall or
Right.
vertebral fractures. I mean, I see this all the time. So, and if that's the case, you need to know this, that this might be one
Right.
of the issues, or even for a younger person or anybody. If you're
Right.
at risk, then you know, and you have to make sure you're really optimizing. So that's the main thing, to optimize their collagen if
Mhm.
that's the problem. Okay, continue. This is so interesting to me.
So then another one is the GDF5 protein, and that is mostly for that bone development and healing. And that is super important when you have a fracture. Do you have this gene and is it working optimally? Because it has the keys to unlock the doors and kind of open calcium into that part of the bone to repair it. So if you don't have this protein bringing the calcium to the part that needs to be healed, then we're kind of just shooting darts at the bone and hoping we're hitting the area that needs to be fixed, the part that needs to be bolstered up. And so it also is impacted by vitamin D and vitamin K, helping to absorb the calcium too. So the protein works with vitamin D, works with vitamin K to make sure the calcium gets to the area of the bone that it needs to get.
Which is so important because I'm such a big believer in that you don't just need calcium,
Yeah.
you need vitamin K2, you need all this. So what you're saying is if you don't have this protein, even if you're taking it, it may not be doing the trick. Is that right?
It may not be, it, your bone may be maybe getting the calcium, but not in the source, not in the spot of the fracture, or at least not as concentrated in the source of the fracture. And so then overall, it's not going to have as much strength around that bone healing. So if you're kind of putting a second layer of calcium on the whole part of the bone, the part that broke is still going to be weak. It's still going to have less connection there. But if you're sending it directly where the fracture was, then you're going to have a strengthening in that area versus if you're just kind of coating this whole bone with calcium. So it helps to strengthen it so you don't have a repeat fracture.
Wow, this is really very important. And the truth is, I've never heard of an orthopedic surgeon or anybody else ordering the genetic test before they do something. So maybe why people aren't healing. There are people that get non-unions, there are people that don't heal. So wouldn't this be a wonderful thing to know? Well, but it's something, I guess there's a disconnect here, correct?
There is a disconnect, and it is just genetics in general is still kind of a baby field. It's still emerging and coming out. Uh, we are seeing some of these history genetic tests kind of showing us where we've come from. But this is another level. This is a deeper level. And it doesn't usually go into the deepness. So far, I've seen your risk factors. Are you at risk for breast cancer? Are you at risk for Alzheimer's? So it doesn't get quite that nitty gritty. It's looking at very specific parts of the DNA and seeing how it interacts with nutrients. There's another test that's looking specific at medications and how medications interact with your body. And so it is, you can get lots of answers without getting too many answers. Some people don't want to do this test because they're afraid they're going to know now that they're at high risk for Alzheimer's or dementia or something else. And it's interesting, actually, the vitamin D can link to Alzheimer's just through a depletion of vitamin D. So you may not just be at risk inherently for Alzheimer's, but having a depletion of vitamin D can then cause or be that domino effect that unfortunately can lead up to that. And so looking at the whole system, looking at how your body interacts with these nutrients and what is the best way to optimize all of that, working with what you already have instead of just kind of, I don't know, let's guess and check and figure it out that way, which can take months or years, or we don't even know sometimes if it's working, versus using that blueprint that we're already given and, you know, going, okay, this is what it says. Let's do this because this is what the data says.
Wow, so not waiting till you find
Yeah.
out you're not absorbing or it's not working effectively. It's so, so very interesting. Wow, we can really talk a lot about this, but that's fascinating because I know people that don't heal and, they just really they give them stimulators or they give other things, but no one really says, "Oh, let's see." And what happens if they find out, they have this issue and they're, not healing? What can be done?
So part of it is it's an information, or at least this GDF5 is more of an information of how we might treat the bone differently. So instead of giving those injections to help bolster it that way, they might give different pins or rods to help support the bone and strengthen it right there at the fracture versus hoping that it's going to mend itself. Because now we know if it's just giving a coating over the whole bone or if it's strengthening that fracture. And so it gives a little bit different approach as far as that. It may also, people as far as the PT may be longer then, so that way we can put more stress on that fracture and help to bolster it that way. It may also have a little bit, let's take it easier longer, not necessarily more
Yeah.
hospitalization, but just more like watching and see and making sure that we're not re-instigating that new fracture before it's got a um, good protection around it.
Wow. Well, we could go on and on. So I think you've given us the basic understanding. And so who in your mind, now this is what you do, who in your mind should get tested? In terms of
So, especially, I really think everybody should get tested because this is valuable information, whether you're in your 20s or whether you're in your 60s and 70s or in your hundreds. So, this information is something we can use regardless of your stage of life. And it's something that we can help shape going forward and making sure every step from that point on is optimized for you and is you're in that uh, best shape you can be, and you're doing everything right according to your blueprint. So it's super personalized, super tailored to you as an individual.
I like a lot of things that you said because sometimes people will just order a test and then they have all this data and it's overwhelming. But I like the fact working with a professional who does this because then you take into account what the person does, you take into account their lifestyle, and then you can make adjustments using this not as the be all end all, but using this just like you said as a blueprint. So I love that. So if people are interested in doing this, can you just share how you already sort of shared how you work with them, but, we'll give the information, but what would you like to say? How people can find out about you or what's the best way, and how long do you work with people with this? I guess it depends, but
So I do have two different options. As far as people working with me, we can just do the test and I can give you the results and kind of the breakdown of what I see in the results. Or I can work with you for 6 months. So I can take that plan, that assessment that I see, and work with you one on one through that 6 months while we're maybe correcting a few things or adjusting some different supplements to really get you to that optimum health. And so it kind of depends on, do you just want the information or do you want to get a little bit healthier and get on that path to wellness? Now, if people want to get in touch with me, I can be found on Facebook at Guided Holistic Health, or you can email me at hello@guidedholistic.health.com. And I'd love to have a conversation with you and we can get the ball rolling that way. And I would love to speak with you.
well, that's so great. There's one more thing I want you to share with people because how we met was that I was interviewed for your summit. And so just tell people also about the summit and we'll have the information. And if it's already gone, you'll still be able, there's still a way to that you can still get the summit. So just sort of tell us about this really interesting, it's sort of a little different than this piece. But when we talked and I heard what you did, I really wanted you to share it because as I said, I'm into the detective business and I don't wanna miss a beat here, and I think what you do can be the missing piece for many people, so I'm so grateful that you came on and shared this with us, but just quickly tell us about your summit so people know, and your children as well, so this might not be for you, but this could definitely be for a child as well, so tell tell everybody about your summit.
So I am super passionate about empowering people in knowing their own bodies and knowing their own health and not just doing, the doctor told me this. Why did the doctor tell you to do that? I don't know. I want you to know why. Let's get curious and get underneath it. And so I created this summit, Mom, no coffee needed, as a way to help empower moms and their families in different holistic ways that we can listen to our body, but then also act on what feedback we're getting from our body. If we're feeling pain or blue, what are some ways we can address those without going straight to medication? Now, I'm not saying keep the doctors out of the loop, but let's bring them in and let's get curious as to what the cause is instead of just taking a medication and doing a bandaid on whatever the symptom is. So getting curious, knowing what your body is, listening to it is all about what my summit is about. And I have many experts and many different goodies and tips and tricks. And I've got lots of different resources involved. So it is just this treasure trove of information. And it's a really great place to start. Or if you've already been on the holistic path for a little while, if you need to get you're like, I'm kind of plateaued. I need something to get me to the next level. So it is a great resource. And so it is launching November 28th, and it is going to run till December 19th. Now, if you don't happen to catch it on those dates, there is a replay available for just a couple days after that. But if it's, let's say we're in the new year and now you just stumbled upon Margie's podcast here or you're just listening to it, then it is available for purchase that you can listen to it later on. And even at that point, there's going to be more and more added. So it's not going away. It's just going to keep growing and getting bigger and bigger. And so it's such a value to be able to access. It's such a treasure trove.
Yeah, I'm really excited about it because there's so many people, the younger you can get people. I mean, at all ages, look, at all ages, we can make changes. We're never too young, never too old. But moms, it's just a time in people's lives that they don't care about themselves. And a lot of, really a lot of things begin that don't have to be. So I think the fact that you're starting with this group of people and really educating them and giving them the tools is so great. So if you know anyone, if you're already on this health kick. It's still, I'm sure there's something still to learn. I talked about bones on this with Dr. Victoria, but there's always something to learn. However, if you have a child or someone, like get them in there because this can make such a difference in their life. Well, thank you. Is there anything else before we end that you want to share?
Nope. I just wanted to challenge everybody to get curious and ask questions and really get underneath the why. Why is something happening? Why is that vitamin D? My vitamin D levels are great, but I'm still having these low bone scans. So let's get curious and ask the why, guys.
Well, I can't thank you enough. I'll have all the information in the show notes. And yeah, I'm excited for your summit. I just think lots of people's lives are going to be changed. So thank you so much for being here and sharing this great information that will help us with some of the whys that maybe we haven't thought of before. So thank you so much for taking the time and being here today.
Thank you so much, Margie and audience. It's great having you listen. So thanks for coming.
I hope you found my interview with Dr. Victoria as interesting as I did. And this could be one of the missing pieces to why you're losing bone. So I wanted to expose everybody to it. And all the links Dr. Victoria talked about will be in the show notes. So thank you so much for tuning in. And I look forward to seeing you on the next episode.